Hello everyone, my name is Jordan and I, alongside my Group 2, will be presenting about the United States healthcare system. This presentation will cover what the current changes the United States healthcare industry is facing and how they impact access, cost, and quality. The United States healthcare system is a complex hybrid, multi-payer system comprised of single-payer, publicly subsidized private payers, socialized medicine, and self-pay. The established system in the United States is amongst the most complicated in the world and is forever changing, molding to new outbreaks as we saw with COVID, and adjusting to stay current with the time. We will touch on topics such as the role of technology and its aid to change, government policy changes, the impact globalization has on the delivery of healthcare, the role of global supply chain, trends and impacts human resources and education policies, post-2020 changes of the Affordable Care Act and their impacts, how local, state, and federal differences impact healthcare, and lastly, changes in the consumerization of healthcare. The United States healthcare system is impacted by a plethora of factors. Factors such as inflation, war, technology, fundings, and pandemics. These factors affect our healthcare system substantially through access, cost, and quality. The healthcare system has been vigorously affected due to the 2020 pandemic outbreak, coronavirus, or COVID-19. Globally, the world was ill prepared for the effects of such a ruthless pandemic. With the highly contagious airborne virus, the need for treatment continued to spike. As factories were closed, supplies became scarce, and with the reliability on technology to aid in care, costs began to rise. With the economy shutting down, the supply chain was damaged. The need for care was increasing, lack of supplies, and with the dependency on other tools such as technology, inflation began. Aiding in the unaffordable costs for healthcare, COVID was the catalyst for the drastic change and lack of access, increase in cost, and decline in quality. Technology heavily impacts the United States healthcare system. Healthcare shifted towards a more technologically advanced approach back in the late 1900s, but started to influence and shape healthcare as we know it in the mid-2000s. Electronic health records became a staple in all medical offices in 2003, and from there, advancements such as robotic surgeries, 3D bioprinting of organs and prosthetics, genomic sequencing, nanotechnology, and telehealth followed. Telehealth became a huge staple after the outbreak of the global pandemic COVID-19. Hospitals closed all non-emergent services and shifted to a tech-based approach to continue care to patients in a safer manner. It was reported that telehealth visits grew by 154% in the last week of March 2020, right after the outbreak of COVID, compared to the same period in 2019, according to the CDC. Technology is highly important to the future of healthcare, and according to the Healthcare Information and Management Systems Society Future of Healthcare report, during the next 5 years, 80% of healthcare providers aim to expand their investment in technology and digital solutions. With technological advancements as such, access to healthcare is easier than it has ever been, but the costs have risen. Although it is unknown how much technology has aided to the increasing costs, researchers agree that it has contributed substantially. The COVID-19 pandemic has hastened the healthcare industry digitization. Health facilities have rapidly extended their usage of virtual care to ensure that patients have access to critical primary care services. A massive increase in the number of virtual visitors was reported by Human Health Services. The statistics increased by 6,000% from 478,333 in 2019 to 28,550,608 by 2020. There was also an influx of health clinics offering virtual visits, which increased by 130% from 592 in 2019 to 1,362 by 2022. The pandemic had a rippling effect across the world, and the United States was underprepared. The economy was not sustained to endure such a heavy impact. In 2020, the unemployment rate throughout the United States increased from 3.5% to 14.7%, which was a record high. 28.1% of the United States workforce were remotely working via telework, and the majority of students transitioned to online schooling. With life and the basic right to healthcare transitioning to a solely technological-based system, policies had to be placed regarding private health information. and due to the ripple of unemployment and businesses shutting down, policies aiding in the unaffordable costs and inflation needed to be established. Alongside the policy regarding HIPAA, policies like the No Surprise Act and the Sustainable Public Health Supply Chain were also important enactments. The No Surprise Act was passed in January of 2022 with the purpose to aid in eliminating surprise medical bills and protecting consumers. Consumers were receiving bills from emergent and non-emergent care from both out-of-network and in-network facilities. This bill restricts excessive out-of-pocket costs. Lastly, under President Biden's administration, he has implemented an executive order to seek immediate action to aid in securing supplies deemed necessary for responding to healthcare demands. All three policies affect access, cost, and quality of care to the public. Globalization has aided improvements in the United States healthcare system. Through global trade, tourism, health knowledge, new health information has been obtained and low-cost health technologies have emerged. With global trade, opportunities to expand markets and access goods and services become available. The market becomes more competitive, resulting in competitive pricing and the option to invest in cheaper products. Globalization is a huge factor that impacts the United States healthcare system. With the rise of transportation, telecommunications, and the quick disbursement of information, the world is constantly conjoined and advancing at a rapid rate. Benefits such as better pharmaceuticals and medical supplies, exchange of providers, medical tourism, and easy access to goods and services result from globalization. Although impacts such as infectious diseases such as COVID-19 are potential possibilities due to the constant exchange amongst people, goods, and services. As saw with COVID, there is a delicate balance required by the global supply chain. The economy and healthcare are intertwined and affect each other on multiple levels. Due to the border closure, quarantine, and social distancing mandate, medical goods and services were in short supply, resulting in lack of various medical devices and personal protective equipment. There were shortages of active pharmaceutical ingredients, aiding in higher costs and low supply. Another area impacted is felt within the workforce. It is predicted by the American Hospital Association that the physician shortfall is estimated to reach 124,000 by 2033. And there will be a need for approximately 200,000 nurses per year to fulfill rising demands for healthcare professionals. Due to the rapid growth of the multifaceted trends and the current shortages of healthcare workers, the system is pre-positioned in a disadvantaged manner. The current rise of cost and provider shortage, the Human Resource Department must implement thorough examination for each region to assess how to best mitigate any problems and set their organization up for success. Hiring process will shift to an advanced practice, seeking nurse providers and physician assistants to aid in provider shortages. Organizations will explore and adopt new patient care models such as team-based care for efficiency and cost-effective strategies. Functional skill-based roles is the new buzzword in the education world. The advancement of technology has eased workflow in every aspect, from medical management, reduction of waste and errors, to communication and education that improves efficiency and quality of healthcare delivery. Because information is a click away, a straight-A student will no longer be the top competitive edge. New hires will now need to possess strong functional skills in addition to equally strong technology skills, while knowledge-based roles get pushed further into the background. The pandemic further catapulted advancements in the healthcare industry, affecting not only healthcare but every aspect of life to include education. Now that web-based learning is the new normal, the question remains, how will online learning affect the future workforce? Can students still obtain the necessary foundation to succeed in their careers? And how can we implement policies in education to not only ensure production of highly trained and qualified providers, but ensure closing the gap of provider shortage is obtainable? The education field has adopted a trend of functional-based education, a framework focused on mastering vital skills and while touching on basic understanding of essential health concepts, further learning in on technology to filter the rest. A 1997 policy stemmed production of medical residency. Education policies as such need revision to support a rapidly growing healthcare industry. It is vital to increase school and residency slots, reduce tuition costs to persuade individuals to seek medical careers, and implement medical school to residency pathway programs to fill shortages in underdeserved communities. Currently, many Americans receive health insurance through an employer or government program. This is best described as a centralized marketplace. The Affordable Care Act meets the expectations set forth by the policy and continues to promote population health. Hoffman describes the Affordable Care Act as a success but highlights the downfall of perceived choice. Being that the United States is one of the only first world countries without a publicly funded healthcare delivery system, the Affordable Care Act is the closest to universal healthcare. Following the COVID-19 pandemic of 2020, the American healthcare system was overwhelmed and many people were left in unfortunate situations. Policymakers were called upon to improve the quality of the current healthcare system, and there are future plans to vote and enact on expansion plans. 2020 was a pivotal time for the world, including the United States healthcare system. The world-known virus COVID-19 made its appearance in late March and had rippling effects on healthcare and unemployment. There were many changes to the Affordable Care Act due to the extenuating circumstances. There were some adjustments from the post-2020 Affordable Care Act that altered the employer's mandate. Employers are required to offer affordable insurance to 95% of their full-time employees and their dependents until the age of 26, or be subjected to penalties. Lastly, the individuals who do not purchase health insurance are free from tax penalty. The United States healthcare system is separated into 3 levels: federal, state, and local. Each level has a specific responsibility and duty to aid in protecting, preserving, and promoting the public's health and safety. Local and state subdivisions coincide with each other. They retain primary responsibility for health under the United States Constitution. It is under their jurisdiction to partake in activities to monitor the burden of injury and disease, identifying individuals and groups that disrupt public health through testing, reporting, and notifying. They provide prevention services and aid to assure access to high-quality healthcare services for vulnerable populations. The state ensures businesses are maintaining safe and sanitary conditions through licensure and inspections. Lastly, they oversee quality of care provided in the public and private sectors. The federal government is responsible in 6 areas, such as policymaking, financing, public health protection, collecting and disseminating information about the United States health and healthcare delivery systems, capacity building for population health, and direct management of services. Consumerization of healthcare is a trend of people partaking, influencing, and controlling their medical care. There are 4 notable changes regarding healthcare consumerization. 1. An increase of digital health, such as telemedicine. Over the pre-COVID state, telemedicine had a growth of 3,800%. 2. There was an increase in collaboration between health and IT companies. It was reported that more than 1,000 technology entrepreneurs just entered into the healthcare industry. 3. There was a massive increase in wearables such as smartwatches, fitness bands, wearable ECG, and blood pressure monitors. In 2020, 43% of respondents claimed to own a form of wearable technology. Lastly, the usage of digital health platforms by providers has skyrocketed. 45 to 56% of providers claimed using digital healthcare practices increased their personal level of job satisfaction. 5 potential risks healthcare could face by 2030 are higher taxes, economic uncertainty, supply chain resilience problems, regulatory risk, cyber threats, and privacy and identity management problems. On the other spectrum, by 2030, healthcare potentially faces positive impacts such as expansions like Medicare for All, sustainable systems, the genomics revolution, the continuation of emerging technologies, and global demographic dynamics. Thank you all for listening about the impacts on healthcare and how access, cost, and quality are influenced and altered by global circumstances such as COVID-19.